The new and very interesting service line that we're looking at right now is prostate artery embolization. And this is fascinating. So benign prostatic hypertrophy, benign meaning there's no cancer involved with it, is a problem that at some point in time will affect any male lucky enough to live that long, or maybe unlucky enough to live that long. When the prostate becomes very enlarged, it obstructs the urethra, and that's how you drain urine from the bladder. And so you can get dribbling, you can get urgency, you can get frequency of urination, very uncomfortable for a lot of aging gentlemen. Now, historically in the past, you would bore out the urethra. Now just think about that for a minute. Bore out the urethra like a roto-rooter, like you would a pipe to clean out a sewage leak. You're gonna do that through the urethra. No thanks, I'll pass. The procedure that's developed on the interventional side of things, prostate artery embolization, is a way to treat that by going inside an artery and shutting it down from the inside. So embolization, process whereby you place a catheter in the target artery, so in this case, the prostate artery, you got one on each side, and you inject these very small particles. Those particles travel downstream with the flow of the blood until the artery becomes so small they can no longer pass. They lodge in there and block the blood flow, and this causes some shrinkage of the prostate gland and reduction of those symptoms. It's very effective and very promising. We may see this someday to be actually I do think we'll see this be the primary treatment for benign prostatic hypertrophy. Now, of course, that strikes fear in the hearts of urologists who, that's how they make their living. Well, all I would tell them is just they may want to take a lesson from cardiology and vascular surgery and learn to work with us and not against us, because it's coming. Some service lines that are on the horizon but not really in active use at this point in time are gastric artery embolization for the treatment of obesity. There is one artery in particular that supplies a part of the stomach, and when you embolize that through the process we were talking about, inject small particles such that they block that artery, there are some changes in the stomach that have physiologic effects and can help with weight loss. So that's something that we will probably see more information from. In addition, we have some people now who are embolizing arteries in the knee to treat certain kinds of knee pain. So very interesting and minimally invasive ways to treat problems that medicine has either no good solution for or more invasive solutions for.